Good morning, good evening, good afternoon, depending where you are based, and welcome to the third edition of the Global Public Health Week, an initiative of the World Federation of Public Health Association aimed to give visibility at the global level to public health. Public health has been the invisible guardian of our health and well-being for decades, and we need to protect public health, to protect us and our community. So let's join forces to make it visible and to make policymakers understanding that we need to invest in public health. During this year Public Health Week, we have decided to give you some peels of the key webinars we ran in the last 12 months. And one of those webinars was run by the International Immunization Policy Task Force and was dealing with protecting the healthcare workforce and public health professionals, with a special focus on low and lower middle income countries. And this is not only protecting them through appropriate vaccination, which unfortunately is not the case in many of those settings, but is a more broad way to prevent the disease and to protect the health and well-being of the workforce in every country in the world, and with a special focus on the less developed setting. So I invite you to listen to Dr. Makinde from Molly Specialist Hospital, Ibadan, Nigeria, to get a very good understanding on the context of Nigeria and what the healthcare workers need and offer to make sure to protect them, to protect the health system, and finally to protect our communities. During this webinar, we also discussed different perspectives from Cameroon, for example, as well as from Mongolia. So if you wish to listen to the full webinar, I invite you to click on the link that is in the chat and get more insight about this very important topic. And in case you want to know more about the International Immunization Policy Task Force, don't hesitate to contact me at marta.lomazzi@wfpha.org. And we will be pleased to give you more insight about that. Thank you.
Yes, so I was saying that in Nigeria, we're currently having an epidemic of brain drain of healthcare providers. And so healthcare providers are seen like a scarce and a very important commodity. They're an essential group within our population. And particularly, this topic is targeting low and middle income countries like Nigeria, where there is scarcity of resources, PPEs, so that makes healthcare workers very vulnerable and exposed to vaccine preventable and modifiable diseases. And worthy of note, like Ayozana has mentioned, hepatitis B, northern Nigeria is known as meningitis belt. So currently Nigeria has a diphtheria outbreak, okay? So this topic is something that, yes, it's important to mention in Nigeria. Something that Marta mentioned during her presentation was the role of research. We ultimately are going to advocate, for policies that will ensure vaccination and protection of healthcare workers in our nations. But where there's paucity of data, paucity of information to back our claims, then our advocacy is going to be limited. And like many of the other speakers have mentioned, also in Nigeria, we have limited research materials, limited research information. And so I think that is somewhere to start in ensuring that healthcare workers are protected. I think part of our advocacy must include advocacy for research. Advocacy for research. This would also help us, seek funding, because funding is essential. In Nigeria, Gavi has done a lot of work in providing funds for vaccination, particularly childhood vaccination. But then there's the issue of donor fatigue. And then we also need to look beyond Gavi. We need to look at other, other NGOs, and particularly our government. So we need to be able to advocate for funding, because like I've mentioned earlier, healthcare workers are essential, scarce in Nigeria, an important population, okay? So high risk. We also need to engage our medical elders. I think Dominic mentioned something like that in his presentation, in that apart from getting advocacy from the government, healthcare, different bodies of healthcare workers, different associations, and in Nigeria, particularly our medical elders who have, had more time in the field, has seen the risk, should have a louder voice in advocating for vaccination and other means of protecting healthcare workers, because truly, I think our risk it cannot be overemphasized. In Nigeria, there's no specific policy targeted to protect healthcare workers, but I don't think that's peculiar to us. I think many countries do not have a specific policy, but we need to come up with one. It would help, specific policies, for example, mandatory vaccination that's integrated within our pre-employment medical screening, and just to come up with an appropriate national policy that is specific to ensure that healthcare workers are provided. Educating our leaders, our community leaders, and then integrating this concept within our medical curriculum, so the medical students also come up with, are groomed also with this idea that they must not just doctors, nurses, all the health sectors where we have high risk of coming down with vaccine preventable infections. We should integrate this topic, the importance of protecting healthcare workers in their curriculum, so as to achieve our goal. Okay, so I think I'll stop here for now, and then we'll discuss more during the question and answer section. Thank you.